What is the best way to remove bikini hair? Is laser hair removal safe for bikini area? Yes, absolutely safe. Actually, pubic area is one of the best areas for laser. Who is eligible for bikini laser hair removal? Minimum age I recommend as a gynecologist is 18. Is laser hair removal safe for the pubic area? Who can get it done? Which laser is best for Indian skin? How many sessions will you need? So, hello everyone, I'm Dr. Anjali Kumar, and I once again bring greetings to you from Maitri, a space where we talk anything and everything related to women's health. And before we begin, do not forget to subscribe to Maitri. We are so close to 1 million, and it would mean so much to have you with us on this journey. So let's start. How does laser hair removal actually work? So a laser is actually an acronym. A laser is essentially a concentrated beam of light, and it works by principle of selective photothermolysis. Now, what does this mean? So it means that when it is directed at the skin, it targets the melanin, the pigment inside your hair follicle, and sort of burns it. That light converts to heat, damages the root of the follicle, and over time, it stops or significantly slows down the hair growth. The important thing to understand is that it works on the follicle, not on the surface of the skin. That's what makes it different from waxing or shaving. Is laser hair removal safe for bikini area? Yes, absolutely safe. It is safe provided it is done at the proper clinic with a qualified dermatologist using the right laser, right settings, and under clean, aseptic conditions. It might require multiple sessions. In fact, over a period of time, it will actually help to reduce ingrown hair, razor bumps, darkening caused by repeated shaving, and medical conditions like hidradenitis suppurativa. Actually, pubic area is one of the best areas for laser because the hair in this area are typically coarse and dense and respond very well to the treatment. However, the skin hair is very thin and more sensitive than the other areas. So the right laser setting matter more. Who is eligible for bikini laser hair removal? So the minimum age I recommend as a gynecologist is 18 because before that, the hormones are still fluctuating, which can keep stimulating new follicles, meaning that you might get hair growth even after treatment. Once you are 18 and your hormones are generally settled, you are a good candidate for laser. And just to remind you in between, if you are finding the video informative so far, do not forget to subscribe to Maitri. Which laser is best for Indian skin? So there are 4 types of lasers used for hair removal and they work for different skin types. Number 1, diode laser. The diode laser is considered the safest and most effective option by dermatologists. It penetrates deeper into the follicle, causes less damage to the surrounding skin, and is well suited for the Indian skin. Second, Nd:YAG laser. There is better penetration, lesser epidermal damage, lower risk of burns, perfect if your skin is darker, sensitive, and prone to pigmentation. Third, Alexandrite laser. Fast but selective. Good for fair skin plus dark hair. Greater penetration. Good for lighter hair. Not really ideal for Indian skin. Higher risk of pigmentation if it is not used correctly. Fourth, ruby laser red light. Now, this is delivered through synthetic ruby crystals, more effective for lighter skin types with darker hair. Then IPL. This is not really a true laser. It is cheaper, but also lesser effective. Most important tip, when you visit a clinic, ask them directly, what laser do you use and is it right for my skin type? A good clinic will always assess your skin before they begin. How many sessions are needed for hair reduction in the bikini area? Now, this is dependent on your hair density, thickness, skin type, hormonal factors, and the area being treated. So, the average is 6 to 8 sessions for adequate reduction. Depending on your hair density, thickness, skin type, hormonal factors, you might need more sessions. The gap between the sessions also matter because of the hair growth cycle. The laser only works on hair that is in the active growth phase, called the anagen phase. Not all your hair are in that phase at the same time, which is why you need multiple sessions spaced over time. The standard gap is about 3 to 4 weeks between the sessions. Will laser hair reduction leave dark marks in the bikini area? Now, this is one of the most common concerns, especially for Indian skin, and I understand it is valid. If done correctly with the right laser and the right settings for your skin tone, laser ideally should not leave dark marks. The risk of post-inflammatory hyperpigmentation, darkening of the skin, increases when the not right laser is used and when the energy settings are too high for the darker skin type. After any session, you actually may see some temporary redness or mild darkening, which usually resolves within few days, and that's normal. Persistent dark marks are not normal and should be definitely reported to your treating clinic. Will the hair come back after laser hair reduction in the bikini area? So, laser hair removal is clinically described as permanent hair reduction, not permanent hair removal. Most people actually see a reduction of about 70 to 90% after a full course of treatment. Some follicles may survive, and even hormonal changes such as PCOS, pregnancy, or menopause can also reactivate follicles over time. So, I have seen in practice most patients need a maintenance session once every 6 to 12 months after completing their initial course. But the dense, regular hair growth, for most people, this is genuinely and significantly reduced after the laser session. DIY laser hair removal in the bikini area. Can I do it myself at home? Now, this is the latest internet trend and definitely not medically recommended. Laser hair removal is not something you should do yourself. Remember, laser is designed to target pigment deep in the skin. If the settings are even slightly off, you are risking yourself for burns, blisters, and long-term pigmentation. And with Indian skin, this risk is higher because our skin has more melanin. The laser can accidentally target the skin instead of just the hair. At-home devices may look very convenient, but they are weaker for a reason. They are not designed to give you clinical results. So what you often get is either minimal reduction or repeated use, which actually increases the chance of damage. The bigger issue is that you don't know what settings your skin actually would need, especially in the areas where the skin is very delicate, like bikini area. So I hope this helped clear some of the confusion around laser hair reduction today and made it a little easier for you to decide if it is something you would want to go ahead with. So take your time with it, choose the right clinic, and do not hesitate to ask the right questions, because when it is done correctly, it can actually make a huge difference. And if you're still confused about anything or have more questions, just leave them below in the comment section and I'm here to help. And as always, do not forget to hit the like and subscribe button for more women's health tips and insights from Maitri. Until next time, take care and I'll see you soon.